Roy, like R-O.
Yeah, R-O-Y-A, you know, royalty.
Roy, oh, Roy.
It's an old English name.
Yeah.
But I'm from Boise, Idaho in the U.S., and I have been coming to Nepal for, I would say, about 17 years now. And I've been living in Nepal for 7 years. I'm doing social service work, helping to support Nepali culture. We've done a little bit of help with earthquake relief and bringing funds in and aid supplies for some medical clinics, and also Dr. Rishi was involved in doing some earthquake relief in the villages, and we helped him a little bit. And it's been just a most enjoyable experience to come close to the Nepali people and their culture.
So you live here a long time?
Yeah, 7 years.
7 years.
Living here 7 years.
And how it's possible that you came into Ayurveda?
Well, I've been aware of Panchakarma and Ayurveda for quite a long time, since about 1985. Was studying a little bit about Ayurveda, and I experienced some Panchakarma back then. And so I've been a long time familiar with it. And I had been supporting my elderly mother in the U.S. For quite a couple of years, and then after she passed away, I thought I would come to either India or Nepal, because Panchakarma and Ayurveda treatments are much more affordable here. And a friend of mine recommended that he saw a poster of Dr. Rishi's Ayurveda Health Home.
Where?
Yeah.
Poster, where?
A poster, it was in a Nepali hotel.
Oh, cool.
And he recommended I try it in 2006. So I came over for 2 weeks, and I fell in love with the treatments and the people, and they gave me such great care. And at the time I was going through a very stressful couple of years tending to my elderly mother, and it was kind of very emotional and everything. And I had a little bit of a heartburn, and I hadn't seen a real doctor about it. And I went through the treatments. I told Dr. Rishi about it at the beginning, and then he did an interview with me at the end of the treatments, and we talked about everything, and I had completely forgot about the problem. And then he said, oh, and by the way, that murmur you were feeling, that's gone now, isn't it? And I said, well, yeah. And I said I hadn't thought about it for almost 2 weeks, and I said it went after 3 days. He says, oh yeah, that was a very easy thing to get there. Some thought to disturbance. So I became very impressed, and I've tried to do regular treatments of Ayurveda over the years. I just finished a 28-day program, which is, they call it the classical 28-day Panchakarma program. And you feel really clean and pure afterwards. And I lost about 8 kilos, which is you lost 5. Yeah, and it wasn't a strain. I mean, the food was very delicious, but it was low sugar, low oil and fats.
Vegetables.
Yeah, lots of vegetables and sources of protein and everything. I never felt hungry.
Yeah,
and the diet was moderated according to what treatment cycle you're going through, what kind of purification you're going through. And I felt that what it did was very unusual. It's like we all know what we should eat. But we desire, we don't do it, and we desire other things. But what I found is going through the treatments, it changed my appetite. It was like all of a sudden I didn't desire any of the bad things, or the sweets, or the cheese, or all these different things that we do. I desired really fresh, pure food. And it was just coming from inside myself. It wasn't an intellectual thing. And the weight was gone, and so I felt like he had me on a program of doing yoga asanas and walks, and I just continued that when I left the clinic, went into activity, and I started going to the gym and started doing longer walks, and I lost a couple kilos. of weight, and I felt very rejuvenated, but I felt energetic that I wanted to engage in more exercise, and I wasn't desiring the bad things that get me into trouble. And then, I don't do just completely, I don't ignore allopathic medicine or regular checkups. So I went in to see my allopathic physician, and I did a full lipid profile, and I did a blood level sugar test, fasting sugar test, and I did an ECG, electrocardiogram, and he told me everything looked great. Heart was strong, blood pressure was normal, and my cholesterol was down, and my blood sugar was completely normal. So he said, yeah, you just keep doing what you're doing.
So that's great.
I felt great. Great.
And I heard that you're doing this treatments for every year now, for I think over 10 years.
Yeah,
At Dr. Rishi's Health Home.
Yeah, I've done several long treatments, and in part because I'm living in Nepal, and because of my work, I have to be in Kathmandu, where it's an overcrowded city, and there's lots of traffic and pollution, and I have to work in this environment, and I'm not always able to eat the best food. Sometimes I have to go to restaurants, and I have an appetite for pizza and things like this, and so I feel that it's a really good health regime. And my philosophy is I have no health insurance. I carry no health insurance. I do have USA Medicare, but it's invalid outside of the U.S. So essentially I have no health insurance, and I find the very best investment is to put it in purification programs to keep me doing healthy exercise and eating a healthy diet. I think any doctor would recommend that's probably the best way to go to prevent any problems.
And now you said before that you are having Ayurveda also in India, and you said the treatment here is better. So
yeah,
what's the difference between, because when I went here, I said before I'm from Austria, and when I came here, everybody told me, you are doing Ayurveda, you have to go to India. I said, no, I think a better one is Dr. Rishi in Nepal. So what's the difference?
Well, the difference, to be a humble American, I would say the difference between India and Nepal is like the difference between the United States and Canada.
Okay, I see that.
When you cross the border, the people are softer and more gentle. They have universal health care. In the U.S. we don't. They don't have gun violence in Canada, and the Nepalis are like that. I think the environment is a little bit softer here.
Everybody told me that the treatments in India are very noisy. Very noisy. Everybody's talking, everybody's doing something, and here is everything quiet and very concentrated.
I think part of the secret is Dr. Rishi has the excellent both allopathic and Ayurvedic training, because of his prior medical school and prior Ayurvedic medical school training. And he partnered with a highly qualified nurse from Marlies from Germany, and pardon the expression, but a good friend of mine said, "Oh yeah, Marlies, she could run a Panzer tank division. She's extremely organized, meticulous person, and she brought in just incredible hygiene. She selected all the materials that went into building the guest house. All the facilities are really very high quality guest house. Everything is immaculately clean. They hired a chef to do the cooking, and so the food is very beautifully prepared and very nicely presented. It's just everything is very first class. But one of the real secrets is their training of the therapists. They informed me. I said, well, this is so unusual. Your treatments are longer than what I get in and the technicians seem to be better trained than what I've experienced in India.
They're so similar. What
Yeah,
they're doing in Britain.
yeah, and they told me, they said, well, we put them on a training program for an entire year before they're allowed to touch a patient. And so the training is really excellent. And then they have to go through retesting every year, they have to go through tests. And so they're very well trained. And the treatment rooms are very silent. You know, it's just a well done operation. I think it's partly because of the partnership of Western, German organizing power and Asian expertise.
So, last question: what would you recommend when people are coming to Western people are coming to Nepal and having some treatments? What treatments would you recommend?
Well, I would recommend to try to organize either a Skype or WhatsApp consultation with Dr. Rishi. And he makes himself available to talk to people, and they can bring up their problems, their situations, and he can pretty much tell what might be best for them. And then some people come wanting to do a 4-week program, and Dr. Rishi will tell them, well, that would be a little too much for you. I think maybe just 2 weeks would be good, and then you can do some vacationing or whatever. And other people, he might recommend more than that. And so he will tailor things according to people's needs. But consultation with the doctor before you come from your home country is, you know, if you have any questions, you can clarify.
So, thank you. From Idaho.
Yeah.
Namaste.
Namaste.
Thank you. Thank you.